Welcome to Crazy Medic's YouTube channel. If you enjoy our content, we would greatly appreciate your support by subscribing to our channel, liking our videos, and sharing them with your friends and family. We'll be discussing a topic that affects many women worldwide. Polycystic ovarian syndrome, or PCOS, is a hormonal disorder that affects the ovaries and can cause a range of symptoms. Women with PCOS have a higher level of androgens, which are male hormones, and this can cause issues with their menstrual cycle, fertility, and other health problems. The condition is called polycystic ovarian syndrome because women with PCOS often have small cysts on their ovaries, but not all women with PCOS will have these cysts. It is important to note that PCOS is a complex condition and the symptoms can vary from person to person. In fact, some women may have PCOS and not even know it because their symptoms are mild or non-existent. What are the symptoms of PCOS? The symptoms of PCOS can be divided into three main categories. Menstrual cycle irregularities. Women with PCOS may experience irregular periods, heavy bleeding, or no periods at all. Hormonal imbalances. High levels of androgens can cause excessive hair growth on the face, chest, and back, as well as acne and oily skin. Women with PCOS may also experience weight gain or difficulty losing weight, and dark patches of skin on the neck, arms, breasts, or thighs. Fertility issues. PCOS can cause problems with ovulation, making it difficult for women to get pregnant. It is important to note that not all women with PCOS will experience all of these symptoms, and some may have only mild symptoms. What causes PCOS? The exact cause of PCOS is unknown, but it is thought to be related to a combination of genetic and environmental factors. Research has shown that women with PCOS have higher levels of insulin, which can cause the ovaries to produce more androgens. Being overweight or obese can also contribute to insulin resistance and the development of PCOS. Other factors that may contribute to the development of PCOS include inflammation. Women with PCOS have higher levels of inflammation in their bodies, which may contribute to insulin resistance and other health problems. Hormonal imbalances. Imbalances in other hormones, such as thyroid hormones, can also contribute to the development of PCOS. Genetics. PCOS tends to run in families, so there may be a genetic component to the condition. How is PCOS diagnosed? Diagnosing PCOS can be challenging because the symptoms can be vague and vary from person to person. There is no one definitive test for PCOS, so doctors typically use a combination of tests and assessments to make a diagnosis. Some of the tests that may be used to diagnose PCOS include blood tests. These can be used to measure hormone levels, including androgens and insulin. Ultrasound. A pelvic ultrasound can be used to look for cysts on the ovaries. Physical exam. A doctor may perform a physical exam to look for signs of PCOS, such as excessive hair growth or dark patches of skin. In order to be diagnosed with PCOS, a woman must have at least two of the following three criteria: irregular periods or no periods at all, high levels of androgens, cysts on the ovaries, although this is not always present. How is PCOS treated? The treatment for PCOS typically depends on the specific symptoms and concerns of each individual. Here are some common treatment options. 1. Lifestyle changes. Maintaining a healthy weight through diet and exercise can help improve insulin sensitivity and reduce symptoms of PCOS. A balanced diet rich in fruits, vegetables, and lean proteins is recommended. Exercise can also help manage weight and improve mood. 2. Medications. Depending on the symptoms, doctors may prescribe medications to regulate the menstrual cycle, control insulin levels, and reduce androgen levels. Birth control pills, metformin, and spironolactone are some of the common medications used to treat PCOS. 3. Fertility treatments. For women who are trying to conceive, fertility treatments such as ovulation induction or in vitro fertilization (IVF) may be recommended. 4. Surgery. In rare cases, Surgery may be recommended to remove cysts from the ovaries or to reduce androgen-producing tissue in the ovaries or adrenal glands. It is important to note that PCOS is a lifelong condition and there is no cure. However, with proper treatment and management, women with PCOS can lead healthy and fulfilling lives.